Hi, I'm Dr. Nilam Khurana, and we're talking about the 12 to 15 month development today. So the things that are similar from before are the progress in like gross motor movements. So some kids don't have to walk till 15 months. Some kids don't crawl, but crawling does help with that bilateral coordination. Most kids should by now have pulled up to a stand, been walking along furniture, and by 15 months they have to be walking well. If they're not, then that's something that you want to talk to your doctor about. And then speech, and I like to remind parents that communication is different than speech. So words start, usually they have their first word by a year, 13 months is usually the latest, but more importantly, they will communicate really well. So kids will make great eye contact, look at you, try to read your face, figure out what you want them to do, figure out how to manipulate you, and ask you to do things without actually using words. And so my minimum by 15 months is 3 to 5 words. But more importantly is that by 15 months, I want them to understand simple directions and follow them without you having to show them. So like, go get your alphabet book for me from the room or something like that. They'll go get it. I want them to ask you for things without physically directing you. So I want them to bring you a book if they want you to read it to them, and get up in your lap and go bah, 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 which may mean nothing, but as long as there's an attempt to say something in intonation, you can understand what they're trying to tell you. So you should be able to understand what they're trying to tell you clearly by their nonverbal communication. And then they'll be helping out. They'll be like lifting their hands and helping when you're trying to dress them, or lifting their hands to try and get you to hold them up. And they will have some stranger danger still, maybe, but they should also have the ability to comfort well with you. So if they're cranky and you don't know why, or you can't figure it out and not easily consoled, then that's a concern that also you should bring up. And then also when they are communicating with you with a nonverbal communication, the gestures, one of the sites that I like you to look at is the First Words Project. It's 16 by 16. So 16 gestures they should have by 16 months. So they'll be working on all of this and, waving, pointing, nodding, shrugging their shoulders, all that stuff. They'll also be doing other things in nonverbal communication, like when they're doing something you don't want them to do, they'll look at you, they'll give you that look, and then they'll pause, and then they'll do it, but almost, and they'll look back at you to see your reaction. And so that kind of stuff is the majority of the important communication at this age. Obviously, we still want them to be saying words, but some kids could be saying letters and numbers, which are words, sort of, right? But they're not actually words used to communicate. So we have kids who are saying their ABCs, in this age range, but they don't say milk or mom or water or ball or something that's more functional and usable on a regular basis for them. So that's discrepancy. If that's there, that's something else you should talk to your doctor about. So, and the other thing is the ability to really do a lot. By 15 months, they know everything. They will work you if you don't realize how smart they are. So they will, if you say you're doing something like, we're gonna go to the park, they'll go get their shoes and bring them to the door. They'll understand everything. You don't have to explain it to them as much anymore. So they will also understand the way that things work in the house and how to manipulate people and get their needs met. And they will also start getting a little naughty. And human beings are manipulative little creatures when they're born, and they know how to work things to get what they need or want. What we have to do as parents is help them understand the boundaries between what the need is and the want is, and what is acceptable and what is not acceptable, and help them so that they're not feeling so sort of free as the world. I can do whatever I want to and be the dictator of this house. because that will happen if you don't realize how smart they are. And a lot of people just don't realize how they went from that cute little cooing baby to like all of a sudden ruling the house. So, but keep that in mind, that they are smarter than you think they are, and they understand how to make things happen the way they want it to. Lots of reading, lots of talking, lots of exposing their brain. Their brains are developing so much. I probably sound like a broken record, but 90% of their brain development is in the first 5 years of life. So really feed their brain with lots of stuff. Understand that they understand a lot. And so you're not overwhelming them with information. Their brains are creating gazillions of connections at this point, and you want to give them as much information as possible. So you want to teach them about just what they're doing, help them learn the words, help them learn to communicate, ask them to do things, and really expect them to be able to do a lot more than you generally would, because for the most part, most of the time parents' expectations are under what the child can do. And then the other thing that you can do is like the using their hands now. So they should start being able to use a spoon with like thick enough stuff, or be able to definitely drink out of a cup, holding their own cup. Definitely be able to start trying to scribble and things like that. It's not going to be anything great. They have those big crayon ones that they can use to try and scribble, because they can't have that really good grip. But they do have that pincer grasp, really well. So if they grip the pencil, I mean, they're not going to grip it that well yet, but the point is they can start learning some of these things. And then they will solve problems. They will figure out when things are inside something, how to get it out. If they can't get it out, they'll ask for help. Again, they don't need to use words. They can use signs, actually, that's more. Or they can use different nonverbal communication gestures, like shaking it, looking at you, saying something to you, and asking you to come over and help them. So those are just general things that they'll be doing for their development between 12 and 15 months. And overall, the only things that I want to kind of let you know about red flags, as far as we talked about knowing letters and numbers more than other words, no significant nonverbal communication in the typical form. So the 16 by 16 gestures is important. But if they're doing things like pulling you to take you to something and putting your hand on what they need and not really making eye contact with that, that's a concern. That means that they're not using their nonverbal communication well. I would rather they call you over, show you from a distance. Even if they walk over to you with something, I want them to look at you and be like, this toy won't come out of this container, help me, in whatever words they're going to use, instead of grabbing your hand, putting your hand onto the container that they want help with. So those are the big key points I wanted to let you know about, and some red flags that we look for. I will see you guys soon, talking to you more about the 15 to 18 month and some other things as they come along. Thanks for listening. Bye-bye.